Polycystic ovary syndrome, commonly known as PCOS, is far more than just a hormonal imbalance. It's a complex and often misunderstood condition that affects millions of women around the world, often beginning silently in adolescence and continuing through reproductive years. But what makes PCOS so challenging is how deeply it affects the body, from hormones to metabolism, from fertility to mental health, and how easily it can go undiagnosed for years. At its core, PCOS is a disorder of the endocrine system, the body's system of hormones. In women with PCOS, the ovaries often produce higher than normal amounts of androgens, which are male hormones that females also have in smaller quantities. This hormonal imbalance disrupts the normal function of the ovaries. Instead of releasing an egg every month during ovulation, the ovaries may develop multiple small follicles, fluid-filled sacs, that fail to mature and release an egg. This leads to irregular or missed periods, which is often one of the first signs something isn't right. But PCOS doesn't stop at the ovaries. It's associated with insulin resistance, meaning the body doesn't respond properly to the insulin it produces. Insulin is the hormone that helps regulate blood sugar. When the body becomes resistant to it, blood sugar levels rise, and the pancreas compensates by producing more insulin. This excess insulin can drive the ovaries to produce even more androgens, creating a vicious cycle. The symptoms of PCOS vary widely. Some women may experience very few signs, while others deal with multiple issues that disrupt their daily lives. Irregular periods or no periods at all are common. Many women also experience weight gain or find it unusually difficult to lose weight. Excess hair growth, known as hirsutism, appears in places like the face, chest, and back due to elevated androgen levels. Acne, particularly persistent or cystic acne, and thinning hair or hair loss on the scalp are also frequent complaints. One of the most emotionally painful effects of PCOS is infertility. Because ovulation is irregular or absent, conception becomes more difficult. Some women may go months without ovulating at all, making it harder to predict fertility windows or plan a pregnancy. But PCOS doesn't mean pregnancy is impossible. In fact, many women with PCOS go on to have healthy babies with the right treatment and lifestyle support. Beyond fertility, PCOS can increase the risk of several long-term health issues. Women with PCOS are at greater risk for type 2 diabetes due to insulin resistance. They are also more likely to develop high blood pressure, abnormal cholesterol levels, and eventually cardiovascular disease. Some studies suggest a link between PCOS and non-alcoholic fatty liver disease, sleep apnea, and even endometrial cancer, partly because the uterine lining builds up when ovulation doesn't occur regularly. Diagnosing PCOS can be tricky because there's no single test. Doctors typically rely on a combination of symptoms, blood tests to check hormone levels, and ultrasound imaging to examine the ovaries. To receive a diagnosis, a woman typically must meet at least 2 of 3 criteria: irregular or absent periods, signs of elevated androgens either in blood tests or physical symptoms like acne or hirsutism, and the presence of multiple cysts on the ovaries. Treatment for PCOS is highly personalized and depends on the woman's symptoms, lifestyle, and whether she's trying to conceive. One of the first and most effective approaches is lifestyle change. Even a modest weight loss, as little as 5 to 10% of body weight, can significantly reduce insulin resistance, balance hormones, restore ovulation, and improve symptoms. Diet and exercise become essential tools in managing PCOS. A diet rich in whole foods, low in refined sugars and processed carbohydrates, and high in fiber and healthy fats can help control insulin levels. Regular physical activity improves insulin sensitivity and supports hormonal balance. For women not trying to get pregnant, hormonal birth control pills are often prescribed to regulate the menstrual cycle, lower androgen levels, and reduce symptoms like acne and excess hair growth. Anti-androgen medications may also be used in some cases. If fertility is the goal, treatments may involve medications like clomiphene or letrozole to induce ovulation. In more resistant cases, assisted reproductive technologies like IVF may be considered. Metformin, a medication typically used for type 2 diabetes, is also commonly prescribed for women with PCOS to improve insulin sensitivity. It can help restore regular periods and lower the risk of developing diabetes in the future. But PCOS isn't just a physical condition. It takes a toll on mental health as well. Women with PCOS are more likely to experience anxiety, depression, low self-esteem, and body image concerns. The emotional impact of persistent acne, hair growth, weight gain, or fertility struggles can be overwhelming. That's why treating PCOS should always include support for mental well-being. Counseling, support groups, and self-compassion are as important as any medication. The most important thing to understand about PCOS is that while it's a chronic condition, it's not a hopeless one. With the right treatment and lifestyle strategies, symptoms can be managed, risks can be reduced, and life can be full and healthy. The earlier PCOS is recognized and addressed, the better the outcomes. Raising awareness is crucial. Too many women suffer in silence, thinking their irregular periods, acne, or difficulty losing weight is just something they have to live with. But these are signs the body is sending. Signals that deserve to be heard, investigated, and treated with care. PCOS may begin with hormones, but its effects reach every part of a woman's health. And understanding it, truly understanding it, is the first step toward empowerment, healing, and hope.